Hey everyone, welcome to my show, My So-Called Fabulous. I'm Tiffany, and it is so great to actually talk to you today, and you get to see me. I'm so excited because you are seeing me on YouTube, and if you are listening, you can just go on over to Tiffany Blackmon on YouTube and watch us, because we have some things to show you today and so much to talk about. And I have been transparent, everyone, very transparent about my hormones, my hormone health, my so much health. And at my age, at 57, I've been working on this hormone journey for quite a while. Dr. Leanne Scott, she told me I'm postmenopause, and I'm like, kidding me? I feel like I'm out to pasture, but I'm just not, because I'm keeping going. And I have brought to you today a gentleman that I have just recently met, and I was introduced again by Dr. Leanne Scott in Irving. I am introducing you all to Jim Hrncir. Help me out there. I butchered your name again, I'm quite sure, Jim. I'm so sorry.
Hrncir.
Hrncir, and it's spelled so lovely, but I butcher it every time. But you are with Las Colinas Pharmacy Compounding and Wellness Center, and you're actually the owner. So you and your wife started in 1984. Oh my gosh, welcome to the show.
Thank you so much for having me. This is so fun for me to be here with you.
Well, the wealth of knowledge that you are bringing to my listeners, my followers, my viewers, I can't tell you how much I appreciate it, because I really want to get the information out there to all of these listeners, because your health is so important. And we were talking earlier about integrated and functional medicine, and that is what you are supporting, correct?
It is. I love the idea of getting to the root cause of a problem, as opposed to just giving you a Band-Aid therapy. For instance, if you have high cholesterol, I give you a statin drug, which makes your memory fail. It makes you hurt all over, and it lowers your hormones by 20%. And is that a good answer?
No.
And so what if we could just cure high cholesterol with the right eating style, maybe a supplement or two, and you're good to go?
Jim, what percentage of the population that you see, your patients, your clients, want to actually do something and make changes in their diet and their movement pattern, their lifestyle, versus like take a pill, or versus actually do something and be proactive?
We actually have a pretty motivated patient population. And so for us, our patients are coming in expecting to have integrative medicine solutions to their problems, as opposed to, I'm going to tell you all about your new antibiotic or your new statin drug. So we actually specialize in that. And so they come in already with that idea in their head. I mean, it says it on the front sign, when you pull up to our pharmacy.
Yes, absolutely. And you're in Las Colinas. You, in 2017, were the Pharmacist of the Year for the Professional Compounding Centers of America, and in 2022, this year, for Pharmacy Development Services. So congratulations. I'm humbled that you're here in my presence, Jim.
I was humbled to get those awards, to be honest with you.
I can imagine. I mean, that's just your research and your study, not just. I mean, it's all the work that you've done for integrative and functional medicine, right?
It is so fun for me. I mean, I started out in dermatology, and then after dermatology, I got kind of good at that. Doctors all over the country were asking for special dermatology compounded medications.
Really?
And then we got into hormones, because, and my wife does not mind me telling this story, it's not a HIPAA violation. At 28 years old, this is a superstar woman. I mean, she was running for Miss Oklahoma. She was Girl of the Year, Homecoming Queen, all those things at her college, and she's managing a department store. She is photographic memory. She is everything, and she starts having a little problem, gynecological problem. I didn't know anything about gynecology. I'm a pharmacist,
Right.
and she went to the gynecologist and says, oh my gosh, you've got fibroid tumors in your tummy the size of grapefruit, several grapefruit. And she was modeling at Kim Dawson, at that time, and she knows her tummy was pooching out a little. So sure enough, they went into surgery, and it was just encompassed everything. Had to have a total oophorectomy, hysterectomy. So she's menopausal at age 28.
What?
And I saw this superstar woman, photographic memory, can handle 5 irons in the fire at one time, go from that to a crumbling mess. She couldn't remember a home phone number. I just saw her emotionally crumbling, and mentally and physically. Her immune system started crashing and burning, developed autoimmune and inflammatory diseases. I mean, everything started going wrong once she gave up the hormones. So the doctor said, oh, it's okay. We'll just put her on Premarin, pregnant mare's urine. That's a horse piss.
Some of you are on that.
It is horse piss. It truly is. You crush one up at home, put it in some water. It is collected urine from pregnant mares. So anyway, that was the number one drug in the world and up until 2002. So she did horrible on that, and so she and I put our brains together and said, because she's a smart girl, she's not a pharmacist, but she's smart. And we said, what is the main hormone in the body? Well, estradiol. Well, what if we could put that on the skin, get it to go through the skin, miss the liver, and get distributed throughout the body? And estradiol is the main female estrogen. And I'll be darned if all of a sudden I'm starting to get my girl back.
Well, you're kidding.
And we were the first ones to invent the transdermal estradiol therapy.
Okay.
And a gel, and got it tested, and and it was potent and it worked, and then we started, as we evolved in our knowledge, we understood that we had to have a combination of all the hormones in order to be optimal. Matter of fact, gynecologists study in med school. They study out of a clinical endocrinology book, and written by Dr. Speroff. And he says in there, a woman can only be optimal if she has a balance of the actions of all of her hormones, not just estrogen, not just progesterone, not just testosterone, not just DHEA or pregnenolone or thyroid, a balance of all those hormones. And then she can be optimal.
Wow. And that I'm tested quarterly to just see how I'm doing, especially now because it's just kind of volatility in you know what I mean? Just trying to get everything balanced. You're perfect. And then all of a sudden it falls off, the wheels fall off. But we're doing this 2-part series, you and I. We're focusing on female hormones, and we are bioidentical hormones, and then male. We'll talk about the male, but the female, I have been on Jim's progesterone. I'm 57, so I think I started at 45. And I just did that for a long, long time. It was balanced. Now, I don't think I was seeing the proper physician. I think it was, correct me if I'm wrong, was it pretty new when I mean, how many years ago was that? 12 years ago?
Well, when I came up with the estradiol transdermal gel, that was 1986.
Oh, wow.
Okay. So we've been doing it that long, but it didn't become mainstream until years later.
Right. So,
but your doctor was actually forward thinking and putting you, even though you weren't menopausal yet, putting you on progesterone, because women in their 40s, and if you're 40 or older, listen to this carefully. If you're over 40, the chances are that you've lost 80% of your progesterone already.
Oh dear.
Already. And if you're having PMS, and let's say you're in your 30s, you're having PMS symptoms, you're having heavy flow, heavy periods. If you're having those two main things, I'm looking for heavy periods and PMS, then you're probably low on progesterone already, which is not uncommon. And we can give you progesterone. It won't affect your fertility. It won't affect how your body operates, but you'll have a much less chance of developing uterine fibroids. Endometriosis won't be worsened, fibrocystic breasts, and you're going to feel better.
Oh, yeah. I mean, just feeling better is so huge, and you can definitely tell a difference. You met my daughter, which is 23, when you came in the studio.
She's precious.
She is, and she has watched her mama, because I have been through this journey, and she's like, I'm going to do this. And she's going to see Dr. Scott, one of her nurse practitioners. And we were thinking, isn't that a little young to start 23? And the women that are listening to the show are 18 to 57. So
I had a consult this morning at 8 o'clock with a college student in University of Alabama. And anyway, she has PCOS. And that is a big hormonal problem. It's a big insulin resistance problem. And it's going to affect her fertility. It's going to affect her weight. It's going to affect hair. It's going to affect her skin. And so we need to get on this now at 20, as opposed to waiting until she's 30 or 35 and infertile and has gained 50 pounds and has thinning hair and her quality of life is not good.
Why?
So we can do it now and have an intervention and do well.
So tell me this, when I was 23, was I not looking for this? Did I have something like this, or what's happened? Unless
you would have had like real bad PMS or real heavy periods, or maybe you already had endometriosis or fibroid tumors in your uterus, then then we wouldn't have known that you were low on progesterone. Okay.
Right.
But there's little clues. Our body tries to talk to us, but we don't know how to listen to our body, and our body's trying to tell us stuff, but we don't know how to interpret those signals. And that's why a really good integrative functional medicine physician will help you by doing the right testing. Like, for instance, for your daughter, Dr. Scott is going to test her on day 19 of her cycle. Mm-hmm. That's going to tell us more about her hormones on day 19 than it would if they tested her on day 5. Wow. Okay? Mm-hmm. So it's all about timing. It's about ordering the right labs and how to interpret them.
Exactly.
As well as the symptoms, because symptoms are more important than labs. We're not lab rats. We treat patients. We don't treat labs. Labs help us as markers, but they don't really tell the whole story until you look at symptoms.
Right. Well, let me ask you this. Is birth control the answer for the PCOS? I know. That's enough. That's a can of worms, isn't it?
And every doctor who's going to be listening to this is going to cringe whenever I say no.
I do think so.
It can temporarily kind of hide the beast. Doesn't fix it though. I want to fix it. I don't want to just hide the beast. I want to fix it. I want to put that beast out to pasture.
Right. So I have a friend. She's my age. She's still on birth control. She doesn't have a period. But she said, I'll never get it up because I will turn into a total bitch. So I'm like, that hormone therapy, I'm afraid that it's going to cause breast cancer. So I'm not going to do bioidentical hormone therapy. So
the crazy thing is that even in the textbook, the gynecologist studying med school says, Dr. Spiroff says that it's an increased risk of 25% if you stay on the birth control pills, and that increased risk lasts for 5 years whenever you finally get off of them. So in other words, she would be better off on bioidentical hormones than she would be on the birth control pill, and she would not feel like a bee. She would be happier, she would be healthier, her bones would be healthier, her brain would be healthy. Did you know the University of Arizona Medical School released a study last year on 400,000 women? So this is not a little bitty study, this is a big study. 79% decreased risk of dementia in women who use compounded bioidentical hormones.
Oh, dementia.
I don't know about you, but I'm scared of dementia.
I am scared to death.
Put me in a wheelchair and I can still function.
Sure.
But take my brain away, that's it. That's the end.
Jim, you have to come back. I know you're doing a lot of research and work with that study.
I just love the fact that if you didn't use hormones for any other reason, if you could decrease your chances of dementia by 79%, do you not take those odds? Women in the study who are using traditional hormones, which actually are not hormones, they're drugs who have hormonal activity, okay? And they had a 59% decreased risk of dementia. So it wasn't, they benefited, but not near as much as the women who are on bioidenticals.
Unbelievable. So let's talk about, I have right in front of me, I have actually from your pharmacy, I have what I started with, was 12 years ago, the progesterone. Dr. Scott has me on 300 milligrams. Started this.
It's a good solid dose.
So tell me this, it's not one size fits all. For example, if Jane Doe was sitting here, 57, she wouldn't necessarily start first taking progesterone, right? Because then years and years later, I started the testosterone dance because my libido was gone. And then later it was estrogen cream, gel, patch. I'm now on the patch. What my question is, so that's the 3 that I'm on, plus DHEA. Could a person start out with just testosterone? I mean, does that make sense, or is there a pattern?
There is a huge move right now to give women massive, and I'm talking massive doses of testosterone. And those massive doses, unfortunately, are not a balancing act, because remember the textbook in med school says, let's maintain a balance of the actions of all the hormones. That does not mean just give women a bunch of testosterone and let's just see what happens. Because whether you believe in God or nature, whatever you believe in, we came to this dance with an optimal hormones in our 20s, for most women. And so let's just say, what is a testosterone level in your 20s? It's probably anywhere between 40 and 60, okay, on the lab that we would do. And I have doctors who are taking women up to 450. That's a man. That's not a woman, that's a man, okay? And 450 is not okay. And it's not sustainable in order to maintain health.
Wow.
And so it's all about using the right dose, the right delivery method, and getting the right level in the body.
I'm looking at your notes that you shared with me on the benefits of female testosterone therapy. Increased libido is the first thing that you hear, of course, because my libido is so poor and so low, and we're working on it. It's just, it is what it is. But then we go into metabolism, of course, muscle retention, stamina.
Wait, do women want faster metabolism?
I'm sorry?
Do women want faster metabolism?
Oh my gosh.
I'm kidding.
Oh my, oh.
One of my patients came to me and says, Jim, you can't be too rich or too thin.
Of course you can. Of course you can. The metabolism is just so huge, because I'm seeing, if I go to the gym in the morning, or when I go to the gym in the morning, I don't burn as many calories
You're
as
in
I
great
used
shape,
to.
by the way.
Thank you.
I don't know if your listeners know how, you stay in fantastic shape. I'm so proud of you.
Well, thank you. But it's every morning getting up and getting it done. Get up at 4:30 or 5 and just getting it done. People are like, I don't have time. I don't either, but it's very, my belief, we have one body. We have to take care of this.
It's a gift.
One body. Absolutely. Thank you very much.
It's a gift.
But it takes a village to keep me going. But decreased risk of breast cancer. All right, so everyone's there. It is again.
Lots of studies on that too, and I did not know that until I read these studies, because it's all about science for me. I have to have science. I have to have evidence-based medicine. I'm not going to just go out there and just say, "Oh, I feel this way." I want to have science backing me, right. And so anyway, the studies show that testosterone is one of the factors that decreases the risk of breast cancer, which is women's biggest concern. I think, at least. I think it is. I'm not a woman.
Exactly.
But I have a lot of women patients about hormone therapy.
Absolutely. Even, the memory, and that's what's getting me right now, the foggy thinking.
And osteoporosis. Testosterone and progesterone both increase laying down of new bone, okay? There's little cells in your bones called osteoblasts. Nobody needs to know that. I'm not going to test you on it. But,
please don't.
But we lay down new bone and we get rid of old bone, because bone is living tissue. And progesterone and testosterone both help you lay down new bone. And then estrogen helps you prevent losing bone so fast. Therefore, you have healthy bones, because osteoporosis is the number 2 killer of women.
Oh, gosh. Oh
Number
my gosh.
2.
And I have a friend that has that too, and it's just troubling. It's such a troubling.
Yeah.
And has been doing things right, but just genetics and DNA. So testosterone, can you have too much? I know you were talking about high doses.
Okay. Had one of my patients come in, and she said, my husband and I just got this high dose testosterone treatment, and it lasts about 3 months, and so. They said, oh my gosh, I am chasing my husband around the house. He's beating me off with a broom. It is great. And I'm great at the gym, and I'm great at work. And I am just, my brain is on fire. I'm all about it. And then about 5 months later, they came in and said, well, I got my second round of that therapy. And I am so angry. He's sleeping in another room. We no longer are having any relations.
Wow.
And I am mad. People at work are avoiding me. I am just a screaming Mimi. And so, in other words, and I looked at her level, and her level, instead of being 40, 50, 60, was 450. 450. That's a man. That's not a woman. That's a man. Yeah. And her doctor thought that was okay.
Oh no!
And I said, so she says, I got to get these out of me. I got to get these out of me. And the
pellets. Was it pellets?
Right. And I said, you can't. I said, it's going to wear down, and then we'll get you on a more balanced therapy, okay? And she said, okay.
Right.
So in other words, what feels right in the beginning is not going to be long-term right. Whenever you go through these incredibly, we call it supraphysiologic doses that are way higher than what nature or God intended. Okay, whatever you believe in. I'm not judgmental.
Not at all. So yes, I went there one time. I've had pellets one time, but it did not work. I had not that severe, but it didn't work. I couldn't get them out of me fast enough, and so I went more into the creams, and it just worked.
You're on a very balanced regimen right here, and I love the fact that your doctor is so in tune with hormone balance and with getting you the right levels to protect you without endangering you.
Yes, absolutely. Trust her, and to me, that is so important, to trust your physician and trust your team like yourself. So I know once I heard about you, I was like, I'm switching pharmacies. I'm going with Jim.
Thank
for
you so
sure.
much for that, by the way.
Absolutely. Okay, so talk to us about estrogen. Go. Let's have the talk about estrogen.
Okay. Now, the biggest fear is that estrogen causes breast cancer, right? And there was a study in 2002 that was done, and it's called the Women's Health Initiative Study. And I'm not going to test you on this either, but
Please don't.
but a rogue researcher on that study, he was the lead researcher, by the way, and he had a public bias against hormones. He said, I want to get women off hormones. That was his goal. And so when they started this study, it was supposed to be an unbiased study about whether hormones were beneficial or harmful. And so anyway, he, at 5 years into the study, 4.5 years into the study, he stopped. He went to the lay media, which you don't ever do. A real study doesn't go lay media. It goes to JAMA or New England Journal of Medicine and gets peer reviewed, and then they publish it.
Sure.
Well, he didn't do that because he knew he didn't have good data. So, but he went to the lay media, who, they're going to be sensational, right? And he said, we have a 26% increased risk of invasive breast cancer in women who are on progesterone and progestin, not progesterone, progestin and Premarin, pregnant mare's urine. And he said, we need to stop this study. And so the lay media printed it. Well, then JAMA was so embarrassed they hadn't heard about this study, they printed it without peer review, which is weird because these are supposed to be peer-reviewed, science-based articles. Well, 26% increased risk meant one patient in 10,000. And that person could have been eating Big Macs and had an increased risk of breast cancer.
Exactly.
One patient in 10,000. So anyway, there was no, relative risk has to be way, way higher if you're a biostatistician than 1.26, 26% increased risk. Of breast cancer. And so there was no increased risk. Matter of fact, in the estrogen only arm, and they were using the very worst estrogen you can possibly take, Premarin, had a 20% decreased risk in breast cancer. Wow. And it's the worst estrogen. One estrogen tablet of Premarin lasts your body 21 days because your body can't break it down and it doesn't know what to do with it, because it's not human estrogen.
Sure.
And so people like it because it stops hot flashes, but it's just not my favorite estrogen for women.
Right.
But those women were seeing a decreased risk. How about that? So anyway, doctors then started saying, oh, then you can only have women on hormones for 5 years, and I guess then you're supposed to just die? I don't know. Your life is over.
Pasture, right. That's right.
Your life is over. And so for years, doctors, and some doctors still believe this, that women should not take hormones any longer than 5 years. Now, what has been released since then has been telling. And that is the other researchers on the board of this study, because it was a huge study. The other researchers started having the courage to speak up and say, wait a second, we were not consulted on this. The data that was released was wrong. We're seeing a decreased risk of cardiovascular disease. We're seeing a decreased risk of breast cancer. We're seeing decreased risk of all-cause mortality, I mean any cause of death. And matter of fact, the only increased risk was lung cancer, and that was because a lot of the women were smokers in the study.
Oh, dear.
And it had nothing to do with hormones.
Nothing to do with hormones.
So by 2012, both the Endocrine Society and North American Menopause Society had said, you know what, women should be on hormones as long as they want to feel good. Period.
End of story.
End of story.
Well,
there is no reason to get off. Now, I did have a very interesting experience a few weeks ago. One of my dear patients, she's just darling. I mean, I just love her. We all love her. And she was diagnosed with breast cancer. Her husband is an oncologist, a cancer doctor. He comes to me and he says, Jim, my wife does not want to stop her hormones. And I'm an oncologist. And of course, I told her she had to stop her hormones. And I said, Doc, let me give you a few studies that show that even women who have had breast cancer who go back on their hormones have a reduced risk of recurrence. Reduced risk of recurrence if they go back on their hormones. Now that just flies all over everybody's opinion about hormones. And this was released at the San Antonio Breast Cancer Symposium, which is probably the most prestigious breast cancer symposium in the world. And he said, Jim, I subscribe to all of the findings from that. I didn't see this. I said, no, because it's not mainstream. And they introduced 4 studies 4 studies that were done on women post breast cancer, and it did not cause increased recurrence of breast cancer tumors. And their quality of life was better. They had less risk of cardiovascular disease, less risk of dementia, less risk of osteoporosis. These women were living better with the hormones, and they had no increased risk of breast cancer. Matter of fact, the women who had the increased risk were the ones who were taking estrogen blockers, tamoxifen.
Oh my gosh.
Now that just freaks me out because I've been handing out tamoxifen dutifully as a pharmacist for all these years, and I realized that I was doing, and I had a few women who said, you know, Jim, I'm just not going to take that stuff. I just don't feel right about it. And I was just going, oh gosh, it's your funeral. And I was wrong. I was wrong, and they were right.
They were right. They were right.
Isn't that weird? Their intuition was correct.
Yes, absolutely. Sometimes the gut is correct.
And I can promise you, this is going to piss off a lot of doctors and people who believe this. I had one of my patients come up to me. Excuse me, she didn't come to me. I called her and I said, I noticed you're not on your hormones anymore. And she said, oh yeah, I dropped them. And I said, well, we talked about them. And she says, yeah. But my neighbor came over and told me that her friend had got breast cancer and it was caused by estrogen. So I just stopped mine. And I said, so is your neighbor a doctor? No. No. So you believed her over all the studies I presented to you and I gave you your consultation? Well, Jim, I just forgot about those, you know, and you know, I'm not, you know, she's smart. She's a smart lady, but she just emotionally made a bad decision.
Right.
It was emotions, you know.
Very emotional.
And you know, it was bad information. And,
which is out there. Fake news and bad information.
Oh, yeah.
Is horrible.
So sensational.
Yeah, I know. So if you talking about progesterone, which is how I started, what I loved about progesterone, and I talked to my friends in their 40s, was the calming, I could sleep better at the time, the calming effect of progesterone, right?
Yeah, and let's make sure we differentiate bioidentical progesterone, which is what the same as the body makes, okay, versus pharmaceutical progestins, which are chemicalized and they're no longer hormones, they're drugs with different effects and different side effects, according to the textbook gynecologists. And so medroxyprogesterone acetate is a prime example of a drug company that took natural progesterone. They couldn't patent it because it's naturally occurring. So they said, you know what, let's make some money. Let's just chemicalize this natural progesterone molecule into medroxyprogesterone acetate. It's a chemical, okay? And then they unfortunately caused increased risk of women for breast cancer, heart disease, you know, stroke. It didn't help osteoporosis. I mean, it's a completely different drug than our natural hormone, progesterone. Natural progesterone is so cool because when you take it, and especially when you take it orally, part of it is converted to something called allopregnanolone. I'm not going to test you on this either, but allopregnanolone hits GABA receptor sites, and everybody knows GABA. GABA is calming. You know, we have all these neurotransmitters in our body, and GABA is calming, and so women feel more calm. They can sleep. They can have less anxiety during the day, less PMS. Matter of fact, University of Texas Med School did a study on PMS, found out it was low progesterone.
Wow.
Low progesterone.
Low progesterone. And it's pretty simple too.
Yeah, very simple.
I mean, it is 12 years.
And I can tell you that if you use it orally, you get greater effect on that than if you use it transdermally on the skin. Whereas estrogen is probably better used transdermally on the skin than orally.
Right.
Because estrogen orally increases slightly the increased risk of blood clots and that, you know, so. You know, if you have that tendency. Right. But if you use transdermal, there is no increased risk.
Well, I'm excited to talk in the next, series number 2 with you about the application and what your thought process is on that. So what we are going to get into is as male hormones on the next one, so y'all have to follow along. However, I was told by Dr. Scott that you have this, I haven't used it yet, but it's called?
Well, the women affectionately call it Yell Gel.
Yell Gel.
Yell Gel.
Can you imagine, girls? And guys, right?
and we can talk about it at length on the next segment if you want to.
Yes.
But I love Yell Gel because I put this formula together with, it has testosterone. We're going to apply this to the clitoral area, you know, lots of nerves there. It has sildenafil, you know, that's Viagra, you know, and it causes blood engorgement, nitric oxide release, blood engorgement. We also put in naltrexone in there, which causes a release of dopamine, which is that feel good,
Feel good.
climax hormone.
Yes.
We love dopamine.
Yes.
And so anyway, with those in there, you get the area is more sensitive. Women have better climaxes, more easy to climax, and have more intense climax. And just put it on like 30 minutes before, do a little event planning, and hey, we're going to go to town.
We're going to town. Okay. Well, that's what we're going to do in the next segment, everyone. So, Jim, thank you so much for this today with female hormones, and I cannot wait to go to the next segment.
Thank you for giving me an opportunity to share the truth.
And your passion.
Because the truth matters.
Yes, it does. It does. Everyone, thank you so much for listening today. Next week, we're going to talk about male hormones and so much more. And please follow along Tiffany C. Blackmon and on Instagram and all the social platforms and YouTube. You can watch us right here. So everyone, have a wonderful day. Take your hormones and keep being fabulous.